Welcome to the Buckingham Center for Facial Plastic Surgery. In this video, we're going to discuss scar revision. Scars on the face can have an unsatisfactory appearance for multiple reasons. Ideally, incisions are placed in the same direction as natural wrinkles. Unfortunately, when you have traumatic scars, oftentimes nature doesn't allow those scars to be placed exactly how we want them to be. Scars can also be unsightly because they are atrophic, which means that the skin is actually thinned out and doesn't have the natural sebaceous and oil gland appearance of facial skin, or they can be hypertrophic, where they're raised and have unusual thickening to them. So our goals in scar revision are to remove any atrophic areas, to remove any hypertrophic areas, to try and make scars that are in the natural wrinkle lines, and also to be sure that the scars are not depressed in nature. And what I mean by that is that they don't have an inversion to them, because if you have any sort of the scar that's below the level of the surface, then as light comes across the face, it'll create an unnatural shadow. So if you have a scar that is generally in the direction of the natural wrinkle lines, scar revision will just entail removing that atrophic or hypertrophic segment to put the natural skin elements back together. And when we do that in a manner where we use a deep stitch that will dissolve, where we take the skin edges and do what's called eversion. So we literally tent the scar up with the deep suture so that as it heals and relaxes, that skin becomes flat. And even if it's raised just a little bit, it'll still catch the natural light and won't be visible. In contrast again to that inverted scar that'll make an unnatural shadow and will be visible. So then if we have a scar that is not running in the direction of the natural wrinkle lines, we may have a decision to make as to whether we just excise that scar and create a linear scar that is going a little contrary to the wrinkles, or if we need to use a more complex technique, which would be irregularizing that scar. Our mind is very good at seeing straight lines, but if we can make those straight lines very small and irregular, then the brain doesn't pick up that scar as well. So if we have a scar running contrary to the wrinkle lines, we may do what's called a geometric broken line closure, where we make very small 5mm circles, squares, triangles to irregularize that scar and minimize the appearance as it's running crosswise to the natural wrinkles. Oftentimes in scars, if they're linear closures or a geometric broken line closure, an irregularized technique, we can further improve the appearance of that scar once it's healed by doing skin resurfacing using a carbon dioxide laser to remove gently the outer layer of the skin around that scar, allow the body to re-heal that skin, and then even more so blend in the appearance of that so it's less visible than what it is without the resurfacing procedure. So scars can be complicated or very simple depending upon what is present, but we have multiple tools to deal with just about any scar to try and improve the appearance. We hope that's helpful in educating you a little bit about what scar revision might look like, and we hope that you'll be in to see us and let us help you out with your concerns.